Good morning. I'm Rob Pitts. I chair the Board of Commissioners of Fulton County, and it's my pleasure to be here today, uh, joined by, first and foremost, my distinguished colleague, the CEO of DeKalb County, Michael Thurman, as well as Devon Gibson of the Fulton DeKalb Hospital Authority, and of course, everyone knows Mr. Hopper. You will hear from each of them in a few minutes. Also from Fulton County, we have our county manager, Dick Anderson, is here. Dr. Pamela Rochelle, the Chief Operating Officer for Health and Human Services. I think I got that right. And also Sharon Whitmore, our CFO. 1 year ago, as a matter of fact, this month, Fulton County kicked off a study which we called Project CARES, which examined the impact of the closure of the two WellStar hospitals in our community. And what we found was shocking in some ways, but in other ways was simply underscored what we already knew. In the most populous county, in the most prosperous county, no disrespect, Mr. CEO, in this great state, there are still citizens who simply do not have access to health care. And in fact, citizens in South Fulton County live 5 years less than residents who live in North Fulton County. Equity is a major factor. Health outcomes are significantly worse for Black and Brown residents in Fulton County and across the state of Georgia. But as bad as these outcomes are today, without Grady, emphasize this, without Grady in our community, health inequities in Fulton County and DeKalb County would be even worse. So today I'm pleased that our partnership with Grady is entering a new phase to help us turn this tide. Fulton County, along with DeKalb County, has finalized an agreement that will put a laser focus on health access and health equity. For Fulton County, this agreement represents the investment of more than $42 million in Grady this year alone, and more than $430 million over the next decade. In addition, this new partnership will yield 2 new Grady primary clinics in Fulton County, which will allow for more people to get served. We've seen that many of our residents are relying on emergency rooms for health care. But health care should begin when we're well, and these new clinics will help make that possible. I'm also proud that Fulton, DeKalb, and Grady have all agreed to collaborate to develop strategies to address health equity and improve health outcomes for all of our residents through quarterly meetings with that specific focus. We're hopeful that the General Assembly will take additional measures during this legislative session that could further expand health care access for our citizens. Together, we believe that great things are possible, and today is just the beginning of improved health care access for our residents. So thank you for all of your support. And at this time, I'd like to ask my good friend, the CEO of DeKalb County, to make a few remarks.
Good morning. I'm Michael Thurman, and I stand on behalf of our Board of Commissioners and nearly 800,000 residents to first say thank you to my mentor and my friend, the distinguished chair of the Fulton County Commission, the Honorable Rob Pitts. Without his leadership and support, we would not be standing here today celebrating this historic agreement. I want to thank John and all the people here at Grady for their concern, their love, for not thinking it robbery, because they have been asked to stand in the gap during the most critical periods in the history of our state and of this nation. We are here today in a proactive way. The media has covered in great detail, as you should have, the huge health challenges facing the metro Atlanta area, our state, and our nation. We have reacted because of the closure of AMC, the COVID pandemic, and as we stand here, the disenrollment of more than 300,000 Georgia residents from the Medicaid program. But what this represents today, standing with my colleagues, Mr. Chairman, is not a reaction, but a proactive response that will result in improved healthcare outcomes for the citizens of Fulton, DeKalb, and throughout the state of Georgia. I'm so proud to have been given the opportunity to get to know these outstanding public servants and the personnel here at Grady who did not waver and did not falter. We're looking forward to the establishment of 3 new neighborhood health clinics in DeKalb County, Georgia. We're looking forward to mobile health vans that will make accessibility a reality for tens of thousands of residents. So once again, to my friends at Grady, to my chair of Fulton County, to our commissioners in Fulton and DeKalb, I thank you all for creating this partnership. You can curse the darkness, but sometimes it's better to light a candle. What we've done is we've lit a very bright candle that will say to all of our residents that we are here to support you, to create an environment that you can access quality health care in a respectful way that will be delivered by one of the finest medical institutions on the face of this planet, which is Grady Hospital. Thank you.
Good afternoon. My name is Javon Gibson. I'm the CEO of the Fulton DeKalb Hospital Authority. CEO Thurman, Chairman Pitts, John. On behalf of the Board of Trustees of the Fulton DeKalb Hospital Authority, I want to thank you for your unwavering commitment, first, to the citizens of Fulton and DeKalb County, and secondly, for your unwavering commitment to this fine institution, Grady. As you know, Grady is an integral part of the health ecosystem here in Fulton and DeKalb. This process, although this is the tail end of it, has been a year and plus in the making. And one of the things that I find incredibly rewarding about the process was in this negotiation, we saw your county leaders place the health and wellness of their constituents as the primary responsibility and obligation to deliver to a promise. That promise is a simple one, that everyone in Fulton and DeKalb will have access to quality health care. There were 2 core assumptions in this process. The first core assumption was a simple one. Everyone deserves access. The second core assumption, which is just as important, was also a simple one. Grady plays an integral role, a central role in the health ecosystem here in Fulton and DeKalb. So to this end, I want to thank each of you for your willingness to support the ongoing growth and development of this incredible institution. Thank you.
Good morning and welcome. I'm John Hoppert, President and CEO of Grady Health System, and I want to thank CEO Thurman, Chairman Pitts, and Javon. These 4 entities came together at the first of 2023 to renegotiate an operating agreement that had been in place for 40 years. It provided us with the opportunity to create a clean slate and to define what is important to the citizens of these 2 counties and what role does Grady need to play in that. Javon was great in summarizing, as well as our 2 executives, about the need to create additional access to health care within both counties and to get care to where people live. The more we can place primary care and specialty care services in communities, the better we will be at being able to improve the health of the community. That was the key driver behind us moving forward with that agreement. Once we put in place the needs of the people of Fulton and DeKalb County, then the rest was the tactical stuff, the block and tackling, which although we spent a year doing it, I want to make sure everyone understands the camaraderie and the sense of mission and purpose that bared with us throughout this process. There was never a contentious moment, and we kept our eye on what needed to happen. And so through this, Grady will go from having 7 robust primary care and specialty centers in the communities where people live to 12. And my hope is is that over the next several years, the funding will be available from numerous sources to be able to create even more of those contact points within the community, because as I said before, that's how we will improve the health of the communities. I want to thank the two communities for their partnership, particularly when we learned that there would be a closure of the Atlanta Medical Center hospitals. The counties were immediately available to discuss what we thought we needed. The state of Georgia stepped up in a big way to make sure we had the inpatient capacity we needed to take on that additional volume. And as we speak, in the last year, 168 additional inpatient beds have been created here at Grady that over the next 3 to 6 months will be opening and serving additional patients. The counties, the state, the Fulton DeKalb Hospital Authority have created an incredible partnership, focused, laser focused on the health of the people that we serve and that reside within these two counties. So with that, we are going to move to this table and we are going to actually sign a document, and each of us will sign our individual. Later we'll do all the passing of the folders, so we don't keep you waiting on that. But if you all gentlemen, if we would, head this way. So we'd like to open up this moment to any questions you may have, and we'll make sure they get directed to the right person. Questions?
Recap the cost of the opening of these facilities in each county.
The total cost of the new facilities is around $12.3 million. That includes the mobile mammography unit that has already gone into place, and then which we hope to place even another into the market. The split between the two counties, the split of the 12.3, we'll have to get that for you. But there's 3 new centers in DeKalb and 2 in Fulton.
Can you speak to the change in patient volume since the closure of AMC?
Oh, sure. So since AMC closed, we knew that we would see an increase in level 1 trauma volume, given that we were the 2 level 1 trauma centers. We were in a fortunate position that we had the infrastructure in place to take on that additional trauma volume. We also were able to immediately recruit additional trauma surgeons and trauma teams to accommodate that volume. And so in the first year, we saw a 35% increase in trauma volume. The other significant increase we saw here at Grady was in obstetrical volume, newborn baby volume, because that was part of what they did. That volume went to Emory Midtown as well. Overall, when you look at the emergency departments that were impacted, there's numerous, but Grady, Emory Midtown, Piedmont Atlanta, the Piedmont hospitals in the southern counties, and Emory Decatur, all have been receiving emergency patients that would have formerly gone to AMC. So the 5 facilities, what we try to do is the facilities are designed to serve the community in which they're embedded. So if it's a community full of more senior citizens, then that's tailored to them. So some are primary care with rotating subspecialty care. We really want to make sure we get that subspecialty presence into the community. But in some, there will be robust imaging available, CT, mammography, routine imaging. And then in one facility, we will have a rehab program, an outpatient PT rehab program as well.
Any updates on what's happening with the property there?
Do you have any update on the property? No update. from us. They're going to be staggered based on all of the contracting we do and development we do. One of the facilities in DeKalb County is a ground up, out of the ground facility. The others, and one here in Fulton is an existing facility but being retrofitted. The others are all retrofits. So it is staggered as far as the timeline. The plan is to have the majority opened in 24, and there may be the one from the ground up may fall into 25. All right?
Thank you.
Thank you all.